Yeah.
Joining us now, board-certified pediatrician, Dr. Cherilyn Davis. Okay, doctor. All right. I mean, listen, we're a long way from the dark days of COVID.
Yeah.
And we all accept that, okay, the shots, and that became controversial. We know the story by now. But it does seem like this thing is still going to hit us in waves at various seasons or whatever. Traveling's high in the summer, people more indoors in the winter, whatever it is. Now we're seeing this thing in schools as all these kids get back together after a few months off. What should parents do?
Yeah, so we certainly are seeing COVID spikes and peaks still, especially in our practice over the last few weeks, despite it being summer, thinking that we would have a reprieve. It's still here. It's still a problem, but there are steps that parents can take. So those include getting your child vaccinated with the updated COVID vaccine if they're eligible, and talk to your child about the importance of hand washing, both at home and outside of the home in places like school. Definitely create an environment where wearing masks is welcome, again, at home or in places like school with peers. Label your child's personal belongings if you're able to, and then have them store them separately in a personal cubby or locker if they can to help minimize the spread. And keep your child home if they're sick. So if they have symptoms, cough, fever, a temperature 100.4 degrees Fahrenheit or greater, don't send them to school. Similar thinking applies if they've been around someone with a COVID-19 infection that's known. Keep them home, monitor them for 24 hours, make sure that they're not developing any symptoms before you send them in. And take advantage of the rapid at-home tests. We have them. They're a great tool available to us. It's the same test that you would use for adults. There's not a specific pediatric version. And it can be helpful in guiding whether or not your child is actively infected and contagious, and help you know whether or not it's safe to send them into school.
I've always had kind of a hard time, especially as, you know, the pandemic is deeper and deeper in our memory, is keeping track of the guidance of when you actually do test positive. What is the protocol? Do we don't have to quarantine for as long? I remember the days where it was 14 days of quarantine if you test positive or if you're feeling sick. Now, what is that? Because I don't know about you, but I don't have enough PTO to stay at home with my kid for several days at a time.
The guidance has drastically changed, so you're exactly right. If your child has been fever-free for 24 hours and their symptoms are improving, then it's safe for them to resume their normal activities. So the at-home rapid tests may actually stay positive during that period. The guidance has been that if it is positive, it probably means that they're contagious, so to wait to resume normal activities, but some of those tests can stay positive for quite some time. So I would factor in both. If your child's feeling better and they haven't had symptoms, even if they're still testing positive, 10 days later on that rapid test, it's probably safe to send them in as long as they're not worsening.
Right, that makes sense.
And for adults, where does the whole booster thing now stand? Should we treat it like the flu shot every September, October-ish, boom, 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 and get it done? I think that's the scientific term.
Yep, boom, boom.
Yeah, that's a perfect scientific term. I think that's actually a great way to think about it. It's not technically seasonal the way flu is, but I think we're going to start to see it become that way. So a good approach would be to get it at the same time that you're getting your yearly flu shot.
We recently had our 18-month-old checkup with our pediatrician, and so we asked about the COVID shots for kids, and they're still waiting. It'll be a few weeks, but yeah, it's a lot to keep track of, and they get so many shots. It makes me sad.
It's hard. And people are still dying in this country of COVID. I know it's nowhere, it's not in the news cycle the way it used to be.
Right.
Which is a good thing, but
I've seen a lot of face masks popping up too in grocery stores and things like that. So it is out there. We cannot forget. Board-certified pediatrician Dr. Cherilyn Davis, thank you so much for joining us today.
Thanks for having me.
All right, still